Welcome back to my channel. Wait, wrong channel. Why, hello there. Ernie's hanging out. Just the usual. I want to start off this video with a little disclaimer. This is for educational purposes. This video is intended for people who are transitioning and thinking about breast augmentation surgery, or cisgender people who are thinking about breast augmentation and want to see the after effects and what it's like post-op. This is not just another Topless Tuesday. I don't do those on camera. That's probably a bad joke to make. I'm professional. Maybe for my boyfriend. It has now officially been a year since my breast augmentation surgery. Almost exactly a year. I made a video 5 weeks after the operation and I kind of explained what it was like then, but a lot changes within a year. Another thing I want to state is, yes, there are a lot of videos of transgender individuals talking about their breast augmentation surgery, but it's good to get a different perspective because they're also different. Everybody's body is different. Everybody's body reacts differently to surgeries. Nobody is going to be the same and finite. It's important to look at a bunch of different videos and collect the consensus and then make your decision from there. Such a spiel. I got 450 cc's of silicone implant. Now, there is a differentiation between silicone implants and saline implants. Saline implants are less harmful to the body if they were to rupture because your body would just absorb it naturally. Whereas if a silicone implant ruptures, it can be harmful and you have to remove it right away. But the other thing is that saline implants can have a tendency to be ripply and not look as natural depending. Regardless, implants have to be changed, removed every 8 to 12 years. If that's in my ballpark anyway, silicone is okay because it's feel and the confidence that I'm looking for, and that has to do with the way that they look. Speaking of the way they look, if you were born biologically male, your anatomy is different than a woman, obviously, but this affects breast augmentation because sternums in males tend to be wider. So for me, with my bra off, there's a substantial space between my breasts, more so than a cisgender woman, not like a lake, more like an ocean. I meant river. Your nipples are different too when you're biologically male because they're placed a little more to the side than less center to the body than a woman's may be, and that has to do with the placement of muscles and pectorals. So you can expect your breasts when you're transgender to look like that of a cisgender woman. They can look very close, and even if you have the most perfect surgeon, it won't look identical, and that's okay because that's not what we're focusing on. What we're focusing on is all the confidence it brings and the closer you feel to the inner you on the outside. Yeah. 2 weeks to a month after my 5-month post-op video, I began to get stretch marks on my right breast. Here are some pictures. So in videos that I've made throughout the last year, they were red, they were pretty prominent, and at first I was very self-conscious and upset about them, but then I realized a lot of cisgender women have stretch marks. It's a pretty normal thing, especially if you have bigger breasts. It's not something to be ashamed of, and I can happily say now they have whitened. Look at the difference. Kind of unrelated, when people say, oh, you're not a real woman because you can't get pregnant. Pregnancy does not make a woman. There are cisgender women who can't get pregnant, so hold your horses. Those bastards want to run away, and calm them down. When I got my breast augmentation, the implants were placed with an incision under. They were here. You can get incisions that are in the nipple or other places, but this is the typical method used, and it is what the surgeon recommended. Anyhoozle, it's healed really well. I've heard stories from other trans women where they have keloid scars where it's pretty raised and pretty prominent. For me, it's not. It's almost non-existent because he did a good job with the placement. Since the surgery, my boobs have settled quite a bit. They're a lot lower than they were, so it kind of covers the scar. It's like a natural shadow. You don't notice. In like a few months to another year, it'll be whitened and very unnoticeable. But yes, they have lowered. I noticed when I first got them done, I was like the cool mom in Mean Girls. They were rock hard, but now they are very soft. They feel like real boobs. I purposefully wore this top so I don't have to take it off and you don't have to see my bra because you can see they look fine, right? Again, I'm gonna emphasize everybody is different. You can't expect to watch all these videos, do all your research, and determine the outcome of your surgery. There will be things you can't control. But the biggest thing is the confidence you're gonna get from it if you are dysphoric about your breasts. I can't stress enough how much it has helped me to get this surgery. I feel way more comfortable in my own skin. I can look in the mirror and be like, yeah, I like this. I feel good. It's important to note, the more you go on in your transition, the better and better and better you feel. It is such a slow progression that it can be hard to notice and you can feel stuck for a long time, but eventually you will feel so much better in comparison to before you transitioned. It does take time, but things like this really help tremendously. Do recommend. Really, with surgery, the only thing you can control is making sure you follow the rules for post-op care. As long as you follow those, you're gonna set yourself up for the best results possible. It can be very daunting to look for the right surgeon within your area, because how do you know if they're good at their job? How do you know if it's gonna work out? How do you know if they're comfortable with trans women? There's a lot of questions. It's worth doing your research and sitting down for that portion. If you are lucky enough to have trans women in your life that live around you, ask them if they've had the surgery, where they got it done, what they recommend. If they don't recommend that person, thank goodness we have the internet. I feel like the cast of Friends wouldn't have had their problems if Google was invented back then. Back then, it was like 10, 15 years ago. But it's true. I guess that covers everything. If you have any other questions pertaining to the surgery, don't hesitate to comment below with them. I will do my best to answer. As always, I hope things are going really well with you. You are maintaining a positive spirit, trucking along through life. I think this would be trucking. And if you're struggling, be kind to yourself. Super important. I know I'm super cheesy, but it's a part of who I am. Just gotta accept it. I'm sorry if you're lactose. Deal with the diarrhea. Okay, that is it. I will see you in the next video. Take care.